Start. Should the government of Bihar get the benefit of doubt, or should it, along with its political partner, the central government, not be held solely responsible for its poor performance today? Question mark. The center's much touted spirit of within single quote cooperative federalism quotation close has been nothing more than a hollow promise. Stop. There is a glaring gap between stuck ground realities and propaganda. Stop. India's federal system is badly challenged today with partisan governors, misplaced policies, and languishing financial assistance. Stop. Bihar is no exception. Stop para. States, including Bihar, have been in the throes of financial stress from before. Semicolon. The novel coronavirus outbreak and the national lockdown have further weakened their fiscal position. Stop. In fact, Bihar is still waiting for the elusive within single quote special status that Prime Minister Narendra Modi had promised during elections and again soon after Nitish Kumar formed the government with the Bharatiya Janata Party within bracket BJP. Stop. Sadly, it has proved to be another within single quote Jumla. Stop. Para. Bihar has had a long history of suffering because of a persisting feudal political culture that neglected efforts to create industrial capabilities and employment opportunities in the state. Stop. Consequently, the exodus of labor has become a new normal since the 1990s. Stop. Despite the fact that construction of new roads and overbridges made through central assistance in Mr. Kumar's first term along with the contractual requirements within bracket, especially in schools, bracket close, could draw a few migrants back to the state. The situation on the migration front remained grim. Stop. Mr. Kumar has been in power for 15 years, yet the fate of these workers has not improved. Stop. They continue to be vulnerable and compelled to work without any legal protection. Stop para. With the global pandemic and national lockdown causing unprecedented loss to lives and livelihoods, Bihar's vulnerabilities have come full circle. Stop. The state government has failed to ensure proper equipment and healthcare facilities to the people. Stop. It has also dealt with migrants with disdain. Stop. A large number of Bihari migrants in Delhi, Mumbai, and other parts of the country were left stranded when the lockdown took effect. Stop. Some of them tried their best to stay wherever they were, but finally gave up as they had no money or food to survive. Stop para. The heartrending visuals of the poor and helpless migrants desperately walking from Delhi/national capital region back to Bihar reflect the hollowness of the state's approach to tackling a disastrous disease and the consequent lockdown. Stop. Also, some recent developments show that the government adopted a selective approach in disaster management. Stop. For example, while an MLA from the ruling party was issued a special pass to travel to Kota in Rajasthan to bring his child back from there, countless others were left to face socio-economic hardship and apathy within the state. Pauperization is in full swing and the hunger is just killing. Semicolon. Biharis with no support of remittance are on the fringes in their own homeland. Stop. In Goa and other parts of Bihar, children were seen eating roasted frogs. Stop. What could be more pitiful than this in a country that will have food grains of over 100 million tons in warehouses by the end of April, and as according to the Food Corporation of India, where the annual produce is expected to be record 292 million tons in year 2019-20 question mark. Reportedly, India has enough in macro projection. Stop. Reportedly, India has too little with lack of insight in disaster management in a trying time such as this. Stop para. In Bihar, public health was the next thing after education that became corrupted and collapsed. Stop. Opening of new hospitals, including an All India Institute of Medical Sciences and few others, were hardly beneficial for the poor living in rural areas since they do not have the means to avail them. Stop. Unlike the highly publicized claims of Mr. Kumar, healthcare facilities at district and block levels are in pathetic shape. Stop. Para. As per National Health Profile 2019 of Central Bureau of Health Intelligence within bracket CBHI, there are 7,13,986 total government hospital beds available in India. Stop. More precisely, this amounts to 0.55 beds per 1000 population. Stop. Many states even lie below the national figure. Bihar is one of them, experiencing an acute shortage of government hospital beds with just 0.11 beds available per 1000 population. Stop. This is something alarming in a state that was once known for its socialistic learnings. Stop. The odd matchmaking of allies in the ruling government is not creating room for the resolve to help people. Stop para. Irrespective of the fact that Bihar has now a new grammar of politics, the state government has failed to give due weightage to the health sector. Stop. Even when Mr. Kumar may no longer be charmed with socialism, how can he overlook the unimaginable hardship of the poor, the unemployed and the marginalized? Question mark. He must bargain for more from the center because his alliance with the BJP has not benefited Bihar. Stop. The people of Bihar are still waiting for the fulfillment of the promises made by Mr. Modi and Mr. Kumar. Stop para. Ramvilas Paswan, who holds charge of food and public distribution at the center, must think of universalizing the public distribution system. Stop. As a leader from Bihar, he should think of the migrants from Bihar and elsewhere in the country and ensure basic supplies to them even without ration cards. Stop. Mr. Kumar should enable timely policy advocacy for this. Stop. Also, he should not be wary in seeking the views of the opposition's views in terms of crisis management and a plan to rebuild. Stop.